welcome everybody to the autumn meeting of Healthwatch West Berkshire, our second virtual board meeting. I think we're just about getting used to the nuances of this wonderful technology. I was talking earlier, I find it a bit strange because, of course, when you speak, the square suddenly moves about, and where you think somebody is, they've moved. But there we are, that's life. I'd like to welcome those who've registered from members of the public and professions to join us today. I'm pleased to see that we've got quite a few. And before I actually officially get going, I want to record my thanks and the thanks of the board to the staff of Healthwatch West Berkshire, who have performed magnificently in these awfully difficult times. And that, of course, is our Chief Officer, Andrew Sharp, Alice Kanjapi-Clifton, who will introduce herself to you in a little time, Michelle Pace and Nathan Pope. Thank you so much. And I know it's been exceedingly difficult for you having to work away from the office. Well, you might like that, actually. I hope you can get back together before too long, certainly before this time next year. Right, well, thank you. We'll start with introductions. My name is Mike Faraday and I'm the chair of Healthwatch West Berkshire. And I was saying earlier, I find it a little difficult to work out how to do this properly, but if we go down the list that we have on our participants panel, perhaps the rest of the board members will introduce themselves. Which is over to you, Michelle.
Thanks, Mike. I'm Michelle Pace and I work for Healthwatch West Berkshire as the administrator.
And Andrew.
Hi everyone, I'm Andrew Sharp, Chief Officer, Healthwatch West Berkshire.
Leslie.
Hi, I'm Leslie Wyman, board member for Healthwatch West Berkshire.
Adrian.
Adrian Barker, board member, chair of the patient panel, which is the grouping of patient participation groups, and a patient leader at the Royal Berks.
And Karen.
Hi, I'm Karen Swaffield and I'm one of the board members of Healthwatch West Berkshire.
Martha?
I'm unmuted. I'm Martha Vickers and I'm one of the board members for Healthwatch West Berkshire.
And Nathan?
Hello, morning everyone. I work for Healthwatch West Berkshire. I'm an information, digital and social media officer.
Thank you very much. I think that's all our board and staff members introduced. I thought it was all going well with this little list on the right-hand side, but of course it kept moving.
No, so everything keeps moving.
That's right. Well, thank you very much. We have apologies, I think, from board member Judy McCulloch, who we think is just gone into hospital to have a knee operation. The last time I met her, which was about just over 2 weeks ago, she was having to quarantine and isolate herself for 2 weeks before actually going into hospital. So I hope that is going well. And I think Amanda also is that right? Did she send apologies, Andrew?
Yeah, Amanda Cunnington has sent apologies because of her new role in her new job. So there was a clash. I'm afraid she couldn't get out.
Right, thank you. Well, I'd like to especially welcome two members from the professions there, and that's Dr. Sarah Rayfield, Public Health Registrar, and David Dean, who's the Chief Executive Officer of Thames Valley Pharmacies, and they have very kindly agreed to talk for a few minutes before we get down to the meeting proper. We normally try to have somebody give a presentation on something fairly short or fairly long, depending. This is the first time we've actually done it virtually. So thank you very much to the two of you for taking part. And perhaps, Sarah, you could start, introduce yourself and carry on.
Yes, thank you so much. Thank you for having me here today. So my name's Sarah Rayfield. I'm a public health registrar at the West Berkshire Council. And the reason for me coming today is to talk a bit about the joint health and wellbeing strategy that I'm leading on the development of for Berkshire West. I think I have got a small presentation. Michelle, are you happy to share it? Oh, thank you. Thanks, Michelle. So just as that's opening up, as I'm sure that many people may already know, but to give a bit of context behind, so health and wellbeing boards are forums where key leaders from the health and care system work together to try and improve the health and wellbeing of the local population and reduce inequalities. So the joint health and wellbeing strategy for a health and wellbeing board will outline how the board will work together to do that and which priority areas will be focused on in order to really try and improve the health and wellbeing of the local residents. Probably about a year or so ago now, Reading, West Berkshire and Wokingham Health and Wellbeing boards came together and decided that they wanted to produce one strategy together and that will be in place across the 3 local authority areas. And that's because many partners within health and care already work across this larger geographical area. And we also know that many people, many local residents live in one area but work in another. Children may go to school across boroughs. And it was felt that by working together, we could actually make a bigger impact and more of a difference. So this strategy that we're working on at the moment will outline the commitment of the 3 boards to improve health and wellbeing for local residents. And fundamentally, it will determine where money is spent and where time and energy is focused. So it's really important that we get it right. And in order to do that, we know that it's really important that we hear from the public in order to help us decide what goes into the final strategy. And we really want to hear from as many people as possible about what issues are important to them. Our overarching vision is for a happier, healthier Berkshire. And over the next 10 years, we want all children and young people to be helped to grow up well. We want a Berkshire where everyone is encouraged to look after their physical health, where all residents are able to thrive in a community that supports their mental health and well-being, and where well-being at work is prioritised, and where people live longer and healthier lives no matter what their background or economic circumstances are. But the question is, how do we achieve all of that? So we can move on to the next slide. Thanks, Michelle. So what we've done so far across the top is we've looked at the data and we've asked ourselves, what does the data tell us about the population? We've spoken to numerous professionals from different health and care areas and asked them, what do they think we need to be focusing on? We've looked around at what other organisations are doing to see where we can complement them and where we can avoid doing duplication. And all of that work has led us to 11 areas that we've said we feel are important to focus on to make a real difference to health and wellbeing for residents. But now comes some important bit, and what do the public think about those areas? And we want to understand from the public what's important to them and what issues they face and what they think would make a real difference to their lives to make them both happier and healthier. And the way we're going to do that is from a variety of means in the orange boxes. So we're having an online survey coming. We're going to be doing lots of engagement on social media. We're going to be writing to chairs of voluntary organisations, asking them to comment on what we're proposing and what they think we need to be focusing on. We're going to be talking to town and parish councils, youth councils. We're going to be holding virtual focus groups and different engagement groups. And I know Healthwatch are supporting us with all of this as well. And by listening to the public over the next 3 months, we will then be able to transform the 11 wide areas that we've identified into 3 final areas. And we really want to focus on a few areas and do them really well. That's really important to us. And if we can move on to the next slide, thank you. And so essentially, as I've said, this is different ways that people can have their say. So we have an email address, berkshirewestwellbeing@gmail.com, if people want to contact us and give us their thoughts. If people would prefer to write, you can write to your local public health team for your own local authority and for the attention of the Joint Health and Wellbeing Strategy team and public health. There'll be this online public survey. I'm hoping it will have quite a far reach, and we're asking organisations to share it for us. And hopefully it will be, people won't be able to avoid seeing it. So it's really about asking people to take part. There'll be discussion events with Healthwatch. We're having virtual meetings, details of which will be on the local authority websites and social media pages. We're really, really keen to speak to young people, and that will be through youth councils and the peer mentoring network. But it's really about encouraging young people to speak to us and recognise that this strategy will be in place for 10 years. So it's really important that we hear the young people too. And also people can speak to their town and parish councils, who will also be holding events with to help them to represent the public to us as well. And I think that's all I had to say, but I'm happy to take any questions.
Thanks, Sarah. That's excellent. Would any members of the board like to comment or ask a question? Oh, Martha?
Yes, you mentioned youth councils. Are you aware where the youth councils are? What youth councils we have?
I know there's 3 across the patch. Well, certainly there's definitely 2, but I do know that West Berkshire one is dormant at the moment. But there's one in Reading. I'm still trying to find the details for the Wokingham one. But I mean, there's other ways we're going to speak to young people as well, as I said. But yeah, it's a shame about the West Berkshire one. Well, sorry, it's not West Berkshire, it's Newbury. Yeah, Newbury.
Okay, Newbury has one in Essence, but it's being regenerated at the moment. So it's interesting to know that they're one of your priorities, as it were. So we'll make sure that's something that's there, as you know, when we're trying to recruit young people. Thank you.
Oh, that'd be great. Thank you.
Thank you, Sarah. We now.
Can I ask something?
You may.
What are you doing to get feedback from disadvantaged groups?
Well, we're working with Andrew to try and focus on hard to reach groups. I suppose it depends on what type of, in terms of what type of disadvantage. So we're also we're engaging with the Learning Disability Partnership Board, and I'm hoping to engage with the advocacy people as well. We're just starting that conversation. So harder to reach and disadvantaged groups are a big priority for us. I mean, we obviously want to hear from everybody, but we understand that those people may not necessarily engage in the typical way. So we are sort of making it a big focus to speak to people who it's going to be more difficult to as well.
Okay.
Mike,
Adrian?
just to thank Sarah for coming to talk to us, and just to emphasise that I think this is a very important strategy. It potentially directs things over the next 10 years, and to encourage people to get engaged if at all they can. And there'll be, as Sarah said, there's lots of different ways of doing that. So do please get involved.
Andrew?
Yeah, I just wanted to thank Sarah hugely for literally dropping in at no notice whatsoever. We felt it was really, really important that because we only have board meetings quarterly, that it gets raised now, because we do want as many people as possible to take part, to really show we can get some meaningful change over the next 10 years. And obviously Healthwatch is going to be doing all it can to gather as many views from as many people as possible.
Just ask another question.
Quickly, Karen.
You must.
You say it's for 10 years. What's going to happen if in the meantime some crisis happens, a bit like what we're in now? I mean, is the 10 years, I mean, is there room for review?
Yeah, there will be natural checkpoints along the way to ensure that it's still fit for purpose, and particularly thinking about COVID and the recovery from COVID. So yeah, there will be. Thank you. Thanks so much for having me as well.
Right, thank you, Sarah.
Thanks, Sarah.
That's great. And now, David, perhaps you would like to introduce yourself and carry on.
Certainly. So I'm David Dean. I'm Chief Executive Officer of the Thames Valley LPC. So I represent, and the LPC represents, all the pharmacies, all the contractors in Oxfordshire and Berkshire. And I'd just like to introduce Kevin Barnes, who's on the call as well. He's my man on the ground, if you like. So I think he's been sort of working quite closely with Andrew. Any local issues, Kevin's there, quite responsive to really get involved, an interface almost between pharmacies, surgeries and the public and the CCGs, just to make sure that things are working well.
Morning, everyone.
Thanks, Kevin. So I was asked to speak a little bit about the current flu season. Just to put it into context, community pharmacy vaccinate in a normal year about 15% of the population in terms of the number of vaccines that we get. It's about 15%. The lion's share of vaccinations are still completed by GPs, and they do an amazing job, because obviously they have all the prescription to patient lists, and they can target those patients using their databases and invite them in. So community pharmacy has been involved for the last 5 or 6 years now with the flu vaccines. It was a very, very new service for community pharmacy. And For this season, all the pharmacies placed their orders way back in January for this year's stock. But obviously, we all know that in March, a certain pandemic started. And as we got through it, we realised that the pandemic was going to go on through the winter. And it was made very clear by the government and by all the regulatory bodies that it was really, really important that every single person over 65 and with certain health conditions get protection from the flu. So if they do fall ill with coronavirus later on, their body is more able to fight that infection. The government also introduced a couple of new health groups, shielded patients, and those that share homes with shielded patients. And also a massive group, so bigger than the over 65s group. The government's quite keen to vaccinate everybody over 50 up to 64 with a free vaccination. So the season started early this year. We kicked off literally on the 1st of September, a couple of weeks earlier than we normally do. In West Berkshire, we've actually vaccinated 12,500 patients so far, which is nearly 85% of our total vaccinations in this part of the world for last year. 78% of those are over 65s, and the rest are split in the different health groups. Now, you may have heard quite a lot of media stories about vaccines running out all over the place. And yes, in a few pharmacies that has happened. Boots have had to suspend all their online appointments because they realised that they had reached the limit of the vaccines they actually could get hold of, as did Lloyd's. And a lot of the independent pharmacies got all their vaccines in one delivery at the beginning of September and have done the whole lot in literally a week. But there are stocks still coming in, particularly for those under 65s, and there's still stock coming in for those that are over 65. The problem we do have, of course, we know today we haven't got enough vaccine to vaccinate the 30 million people that the government wants us to. So the government has promised us and GPs that there will be 8 million extra vaccines available in November or December to firstly finish off all those high-risk groups and over 65s, and then I suspect to move through the 50 to 64 population. So perhaps starting off with the 64-year-olds, then the 63-year-olds, to help protect those for the winter. And that's where we are. We've had no details, unfortunately, yet of the government vaccine. We believe they've imported a lot from the US. They've already paid for them. We're just waiting to hear how they're going to distribute them and when we can start work on planning for that eventuality. But I'm more than happy to take any questions around flu and anything else that may be on your minds regarding pharmacy.
Fantastic. Thank you. Thank you, David. That's been interesting, and interesting getting an update and a clarification of some of the stuff that's been going on in the media about the shortages and Boots and Lloyd's and so on. I assume that flu vaccine doesn't quite need the extreme low temperatures that they suggested coronavirus.
Correct. It still needs refrigeration, but not the minus 70 we suspect the COVID vaccine will need. A quick point on that, that is going to be 4 or 5 times bigger than the flu vaccine season is in terms of population. And we gather that everybody will need the vaccine twice as well. And I really do believe that it won't be pharmacies or GPs that will be administering the vaccine. It will be mass vaccination centres. So hospitals, football stadiums, you name it. They may have to borrow some pharmacists and GPs to help them, but that will be the scale of the operation.
Oh, fantastic. It's going to be very interesting as to when and if all that happens. So thank you, David, again. Would anyone from the board? Oh, Adrian has got a question.
Yeah, just to confirm that from what you're saying, it sounds as though we don't definitely know that the vaccine is there for the 50 to 65-year-olds. That's what I understood from our surgery as well. They hadn't got any information. They were just waiting to.
We've been promised it. My guess is we will get it, but it won't be until late November, early December. But I think we'll be mopping up some of those that missed out on the current stocks, those that couldn't get there, because the normal uptake of vaccine is 75% of the over 65s. I think what we're going to see is a figure exceeding 90%. So that's good news in a way, but obviously that leaves us short with vaccines for other groups.
Thank you.
Leslie,
you've got your hand up.
Yes. What would your advice be then to people 50 to 64-year-olds? Should they just wait until somebody contacts them? Should they actively try and go out to their pharmacies and get an appointment?
Yeah, public health will be messaging quite clearly when the vaccine is available. I would suggest you wait. We've had a lot of inquiries, obviously, and at the very early part of the season, a lot of people were paying for a vaccine, but a lot of the pharmacies have stopped taking the paid service now to keep it for those vulnerable groups. So I'm over 50, as you may have guessed. So I'm sitting tight, waiting for my free NHS jab when it arrives, hopefully at the end of November.
Right. Okay, thank you. That's good to hear.
Right, well, I think that's no other questions. Thank you very much, David, again, for being dropped in at the last minute. Very interesting and very current and topical, so thank you. Right, well, we'll move on to the next sort of item. I don't really want to go into declarations of interest. They are noted only if there are declarations of interest that anyone has not previously recorded. So any member of the board have any new declaration of interest? No, thank you very much then. We will move on to the minutes. Everyone has had the minutes, of course, and hopefully had time to go through them. So I'm not going to go through it page by page this time. I'm just going to ask if anyone has any clarifications, corrections, errors, omissions, etc. I take it everyone is happy with the minutes. Fine, thank you very much. I trust you can do the necessary, Michelle. And the action log, I don't think we managed to reduce quite a few of the actions at previous meetings. Am I right in thinking we just have 2 ongoing?
Currently, yes, Mike.
So, and both of these, I think, are going to remain ongoing, am I right?
Yeah, I think so, because we'll touch on the maternity report later on, and there's a direct link with the maternity report looked after children and their families. So it all sort of feeds in to a sort of general area of work we're working on. Work plan we're going to discuss later as well, so that'll have an impact on item 2.
Right, thank you, Andrew. We'll move on to item 4, a ratification of a new board member, and I'm very pleased to say that the board is delighted that Paul Wilson has agreed to join the board. He was going to be with us our last meeting, which I think was in August, but due to a plethora of IT problems at varying times, we could just about hear him or not, and he couldn't be in touch with us. So it looks like those have been resolved. And could I just check that all our members of the board are happy that Paul now joins us as a board member?
Yep.
Yep.
So thank you very much and welcome, Paul. You are now officially a member of the HWWB board.
Thank you, and hopefully everyone can hear me this time.
Yes, excellent. Thank you. Right, we move on to item 5, which is the report of the Chief Officer. Andrew, over to you.
Morning, everybody, and thank you so much for everyone turning out. And a special thanks to David, Kevin, and Dr. Sarah Rayfield for turning up at such short notice. But we really felt that with those sort of key issues happening at the moment, it seemed, a really good opportunity to put them in front of the board and the members of the public watching. So thank them greatly for doing that at such short notice. We were still emailing this morning about certain details and slides and things, so thank them very much for that. I wanted to be relatively brief because we've got some time to catch up, and also most of the stuff I'd normally talk about we're covering on the agenda as well. We haven't received any specific complaints about anything we've done in the last quarter. And in terms of what has changed, well, the world continues to spin in a slightly different way, which makes all of our work somewhat challenging. And I think the stuff we'll cover off will show what has actually changed. But I think what's really key, and I cannot underestimate to everybody, is getting feedback in has never been more important, because we are in touch with so many of the providers and commissioners, and they've really welcomed public feedback on how services are working, what could be done differently, what could be done better. So, I would continue to urge the public to get in touch with us and let us know what's going well, what's not going so well, and if they've got any concerns about anything, and that was one of the reasons that we wanted to do a little bit on flu as well, because I know it is something that some people are certainly worried about. In terms of I suppose the other sort of key thing I absolutely want to do, and thank you, Mike, for the very kind thanks to the staff from the board, but equally I wanted to specifically thank Michelle and Alice and Nathan for just such sterling work over the last sort of quarter, because normally we'd find the summer relatively quiet, and I think it's been busier than I can ever remember. And thank them all for just always being there, always being on the end of the phone, the email, or whatever, because it's quite tough, this remote working. It's incredible what you do actually miss from not being in the same room with people, and I think we've managed to hopefully keep things going accordingly. I also wanted to offer a huge debt to Leslie Wyman as well for her work with our team on Maternity Report. And also send our very best wishes to Judy, our board member, who's in hospital at the moment, and we wish her a speedy recovery. And also, I'm so delighted Paul's finally joined us. We've been talking about it for absolutely months, and I think he'll make a tremendous addition to the board. So in terms of very quickly what we've been up to, we've obviously run our COVID survey, and we're just at the moment working on its responses. We've done draft presentations to the primary commissioning board, and there's a slightly more detailed report from both ourselves and our colleagues in Reading and Woking going to the Unified Executive Committee, just to really talk through all the different things. And I thought, I think without going into too much detail, the terrific stuff, more compliments than things that went wrong, which was lovely. Hundreds of votes of thanks to people in the NHS, so that shouldn't be lost. Obviously, our maternity report was finally presented, and we'll talk a little bit more about that, and that is already having some positive effects. We finally published our interim view report, which we did from our visit to Thiel surgery in February. This was delayed because of the COVID outbreak, and Healthwatch England asked us not to go through the usual procedures of getting responses from the surgery in 21 days. So that was published. Our annual report was obviously published as well. The other thing we'll obviously be following up on with some vigour is obviously issues around things like dentistry, and our Voice of Disability report probably becomes ever more pertinent. Our end of life conference, which we had to postpone, which we're hoping to schedule now for March next year. And the other thing that I think is absolutely pertinent is we're hoping to arrange a Thinking Together event in November, and again we'll probably touch more on that later in the meeting. So aside from that, I think the rest of the agenda probably talks for itself. So unless anyone's got any questions, I think we should move on, Mike, if that's okay.
Yes, absolutely. Thank you very much.
Thank
you, Andrew. And we'll move to item 7, which is the COVID-19 care home visit, which Alice is going to talk to us about.
Good morning, everyone. I'm Alice Clifton, the Development Officer for Healthwatch. After our COVID survey, we decided that because of what was happening locally, we needed to visit the care homes. So we started the discussion with the West Berkshire Council, and they allowed us to visit their own care homes. So we've been allowed to visit 4 care homes. So we started our first visit on on the 9th of October, whereby I went to Birchwood Care Home. 9th of September, where I went to the Birchwood Care Home. We did this after doing a risk assessment. And when I visited the care home, I was properly gowned up. I had my visor, my mask, and everything. So, and I spoke to 6 residents. And it was decided that it would be better for me to go rather than the volunteers, because we did not get volunteers who were safe enough to go to the care homes, who were not, who were vulnerable. So we are looking out for young people to come forward to support us in this project. Our next visit is to Willow's Edge, which will be on the 27th of October.
Fine, thank you, Alice. And I think you deserve a great round of thanks for actually going to care homes in the current situation and carrying out this piece of work, because obviously visiting anywhere is not without risks and problems. So well done. And it's nice to see you working at this with such enthusiasm. Okay, thank you. We'll move on to item 8, which is the coronavirus recovery survey.
Thanks, Mike. I also just wanted to add to Alice's point, we are at the same time requesting any feedback from family and friends, relatives of people in care homes to sort of give their perspective on how they've found it, not just for their member of the family in the care home, but actually how it's affected them. So there's details on our website, but I again urge anyone who's had any experiences, good, bad, or otherwise, to let us know what it's like. And we can then present this back to both West Berkshire Council Health and Wellbeing Board. And in fact, the other thing I forgot to mention was we're in pretty regular contact with the Care Quality Commission, who are another organisation who are doing things very differently at the moment. They've cancelled their regular schedule of visits where they would visit every establishment on a rolling basis, and now concentrating on areas of most concern and need. And I'm delighted to be working with them where they're listening directly to our intelligence, and if we've got any concerns and things like that. So again, I just stress it's really, really important that people come back to us with any feedback. In terms of our COVID survey, we got just over 300 responses, which is tremendous, to an online only survey. It would have been nice to have had a little bit more assistance from some of the other partners in terms of getting it out there, but there are a lot of surveys going out, and I think what it has shown is our independence is really important because it doesn't put people off. I am concerned it was digital only, although we did offer telephone access, but no one took us up on it. And digital exclusion is a really serious issue with regard to COVID, with regard to people getting information, and we haven't got good answers to this yet, because all the usual mediums of things like screens in doctors and libraries and what have you are largely redundant. I think what we've got to hope for is that by using the community hubs, voluntary organisations and things like this, we look at alternative means of getting information out and also getting it back in. It's absolutely key in those who are socially excluded. I was really pleased that largely the response we got from West Berkshire Council was of interest, of inclusion, and that included issues like broadband, which we found missing in certain care homes. It's not entirely sorted out, but to not have that in a time of COVID is just not acceptable. So I hope that ourselves, Healthwatch England, and various partners will keep pushing that the quality of that is something that is maintained. We know from just our initial visits, things like broadband is working in one floor but not the other, and in this day and age that's just not how things need to be done. It needs to be parity for everybody, not just on where your room happens to be, or if you're in non-care home environments. This is the other big concern for me. When you see major areas of policy, you know, they very specifically often apply only to specific things, like care homes are a specific thing. That is not extra care living, that is not supported living, that's not shared lives. And they're always the addition or the afterthought. And, you know, one of the things we're looking into at the moment is even things like how regulated supported living is, because the Care Quality Commission doesn't fall under their remit. So COVID survey was all encompassing. It covered mental health, it covered primary care, it covered the community hubs, and we look forward to sort of putting a report out, hopefully sort of November time, with its findings. And as I said, it's going to the unified exec. And I think it's something we will almost certainly have to repeat in one form or another. So, but do keep sending us your feedback about how services have been affected, because clearly things like dentistry are not up and running in a what you might term a normal way. Phlebotomy is still struggling to get back on its feet. And also just services where people were diverted. You know, we know they've suffered, so things like dietary and nursing and health visiting. So as much feedback as we can possibly get would be really, really valuable. And that's all I really want to say on the COVID survey, apart from, as I said, just keep giving us your feedback. That's really important.
All right, thank you, Andrew. Does any member of the board wish to comment to Andrew? Adrian?
Yeah, thanks very much for doing the survey. You've done a couple of presentations. Is that something you could send round to the board? I appreciate it's probably not in the form for public consumption yet, but just...
Yeah, no, absolutely. We'll get the draft presentation sent round, which gave a very quick run through of sort of the basic findings. As I said, you know, one of the really cheering aspects was we had more comments about things that had gone well and had gone badly, and to get over 100 comments thanking specific services, you know, I think the NHS should be really proud of itself.
Right, thank you, Andrew. We'll move on to item...
Oh, Aaron's got a hand up.
Sorry.
I was speaking to somebody who has moved to Kent, and about this digital disadvantage, and she's very up in dementia and working with care homes, and was quite appalled by some of the things that we'd found about the digital exclusion. And she was suggesting that actually the Johns campaign, which I know Andrew I think knows about, which have got are in Reading, a national organisation, but they've got a branch, I think, in Reading. And also the rights for residents would be interested in the report when it's done. So I just wonder whether we could log that.
I think we should log that as an action, absolutely. And I'm equally meeting with the Chief Exec of Age UK Berkshire in the coming days. And I think, again, they're a key partner as both a temperature and a campaigning partner.
Okay, thank you. Thank you, Andrew. We'll move on to item 9, which again is you, Andrew. Some of these things you have mentioned, but I'm sure you're going to mention in rather...
Well, I think maternity I'll probably leave mostly to Alice and Leslie. And I think the key thing is there's a debate in Westminster Hall this afternoon with our local MP talking about this, and she's been very kind about the report and is referencing it within the debate. So that's always good to know. The other really positive thing for me was the connection we've had from Great Western Hospital, Basingstoke Hospital, and to some extent John Radcliffe, because like the other two areas in our CCG area, new mums in West Berks often use Great Western, often use Basingstoke, and then they're outside the CCG. Now, you wouldn't think the clinical commissioning group, you wouldn't think that would matter, but it clearly does. And we've managed to get certainly Hampshire Hospital to talk very seriously about introducing localised services within West Berkshire. And just the action of getting chief execs to talk to each other across these NHS borders is a real result. And I'd commend both of them for opening the dialogue and actually listening. When they saw the report, the one thing they did was listen say we can do something about that straight away. So, you know, thanks very much to Alex at Hampshire Hospital and Sam Burrows and CCG for getting on and doing something. And we know that Kevin at Great Western, the chief exec, is very keen to do it as well. So we'll be keeping the pressure on that. Thinking Together 5, I just wanted to highlight, we haven't got a date for this as yet. And usually, obviously, we'd meet up in, you know, one of the big halls across West Berkshire, you know, have a fabulous day with professionals, service users, service user voluntary groups, and we get to the real nitty gritty of what the challenges were around mental health issues, especially. We're not going to be able to do that, but I think we think we can solve this virtually to some extent. And again, my only concern is around digital exclusion again, and we might have to use our thinking caps. And if anybody has got any strokes of genius, how we can get around this, I think we'll be working very closely with BHFT, Community Mental Health Team, to make sure we don't exclude anybody. Chiefly, we're going to be asking, well, actually, we're going to be presenting the ongoing work on crisis review, which is where Thinking Together had really got to, and had helped stoke a full-blown crisis review of services in Berkshire West. There are some new services on stream, which, you know, sound like they really are starting to answer some of the gaps. So hopefully the CCG will come along and present to the audience what the changes are, how they might affect people, and ask for some feedback on what they think. So one of the things they're trying is they're piloting a crisis cafe in Reading to see how that goes. Now, obviously, this is all pre-COVID, so COVID's had an enormous effect on plans for doing this. And I think we've got to think around, well, is there a different way of doing a similar sort of service where people aren't necessarily at the point of ringing the crisis service, but perhaps struggling or having a wobble and need some external help, perhaps even out of hours. So that's always been very tricky in West Berkshire. And, you know, we've got some fabulous organisations, Open for Hope, 8 Bells, Recovery in Mind, helping out with that. But we've just got to make sure the crisis review has delivered, is delivering. And then secondly, I think the other thing that's really key for us to talk about is how COVID has affected people. There's this feeling in an awful lot of mental health professionals that there is a real time bomb in terms of people's mental health, and not necessarily people who prior to COVID even had mental health issues, but because it's had such a dramatic effect on everybody's life. I think that I'm really hoping the Thinking Together event will be able to capture some of this and deliver back to the professionals what people are thinking and feeling, and perhaps change or come up with some alternative action plans around that. So when and if we get a date, we will obviously blast that out as far and wide, and we'd encourage everybody to do so. Encourage anybody you know who may have struggled a little bit, take part, let us know why they've struggled, what they've struggled with, and to see whether or not our professional colleagues can help them or find solutions. So that's all I really wanted to touch on. End of life, again, I've said we're going to hopefully look at doing that in March, very much along the lines of the conference we were going to do. So we'll obviously be added in advanced care planning, respect to gender, and what people should expect from their healthcare professionals and what the healthcare professionals equally expect members of the public and their relatives. So look out for that in March. That's all I want to say on the Quality and Performance Contact Issues report, Mike. So over to Alice. You're on mute, Alice.
Hello. Good morning, Ken. Leslie, do you want to start this conversation rather than me?
Well, no, I'm fine. What I would like to say, first of all, is thank you very much to Michelle, Alice and Andrew for working so well together to get this report ready and be able to present it so coherently at the Health and Wellbeing Board. I wasn't able to be there myself because I was working, but I think it sounds like it went down really well. It promoted a lot of important discussion. It wasn't just swept away, which we were concerned that it might be originally. So Michelle and Alice, you did the presentation, and I think you did a great job there. I think it's not unusual that you will have people there who are not overly not necessarily interested, but were quite willing to not agree with everything that was said and maybe criticize the numbers weren't great enough, this kind of thing. For my own part, I'm a little disappointed around the data side of things, in that it's actually quite difficult to get the actual data of numbers of women delivering in each of the hospitals. So I've been in touch with Public Health in West Berkshire, and also then that request for data has gone through to the shared team in Bracknell. And basically the most up-to-date breakdown of where women give birth in 1 year in West Berkshire that Public Health had was 2014, which isn't good enough. You know, that is ridiculous. I mean, I know from being a public health consultant myself, I quite understand that quite often public health data takes a while to catch up. But in this instance, I really don't see why the data needs to be so lagging. So I think that we need to keep pushing the shared team for some better data so that we can be sure that the breakdowns that we got back in the survey, because obviously that was only 190 women, and yes, they were able to say where they had their babies, but it would be nice to have the actual data to base that on as well. We'd be on firmer ground, I think, to know the numbers really. So I think that's something that we've got to continue to push really. And it's excellent that Hampshire and Swindon, though, hospitals are so willing to engage. I think maybe we've still got a bit of a job of work to do with the Royal Berks to get a bit more engagement from them, get them perhaps a bit off the back foot. You know, if they have felt that they were being criticised, which they were not, we need to work with them and help them to see that that it is important for us to look at all three hospitals. And actually, they are the main hospital. They do take the majority of women that we have. So we want to work with them. So I think that's really all I have to say. And you know, let's carry on. Certainly working with the health visitors as well. I mean, I know Martha, that you would be quite key in that, I think, with the links that you have into health visiting. And I think obviously postnatal is clearly the one area that's up there that isn't good enough. That's where we need to focus our push really is on the postnatal services, and health visiting is absolutely key in that.
Martha, you want to say something?
Well, just quickly, I'm sure you've got a lot to say, Alice. Yeah, just on the health visiting, I think it was good that you were able to sort of get some input from that aspect. And obviously, as Leslie said, it's something we've got to sort of engage a bit more with. But it's the mental health aspect, you know, the fact that, and particularly now, and we're hearing more and more on the media about how women have suffered through COVID, particularly regarding their mental health. And as we keep mentioning as Healthwatch, the importance of the first 1001 days on the rest of life. And this is sort of really, really crucial that we get this right. So I think we've highlighted something that's really important to look into more going forward. I did ask about, because I wasn't clear about whether health visitors have been redeployed during COVID, you know, into other, to help with the COVID crisis. And I was told by Public Health, by Matt Pearce, that hasn't happened in West Berkshire. So, because that was a worry I had, that the small group of health visitors had even been shrunk even more by being sent off to do COVID work. But that hasn't happened here, but they still had to do most of their contact online. And that's not good enough. You don't learn how someone's feeling. You don't react with them. You don't see what else is going on. You don't see whether there's concerns about domestic abuse in the home, etc. if you're online. And that's a big worry that I think there's lots being missed there's not just the postnatal, you know, the depression of the mother, but other things in the home. I know I'm going beyond the maternity report, but I think this is what is picked up by health visitors and midwives when they go into a home, is what else is going on. And we're finding that referrals, you know, within the council for, you know, concerns with children and concerns about domestic abuse, they're all going down. And that's because they're not being picked up. And I think that's a big concern that we have going forward.
Yeah.
Thank you, Martha.
Yeah.
Just to say, Mike, on top of what's been shared, we also are in the process of developing, or we are in development of the West Berkshire Maternity Forum, which is very much led by the Facebook group, the New Mums 2020. So I would like to thank them for their participation, because they have been very involved in this report. I mean, one of the things that we have highlighted in the report that is important is the continuity of care and health visiting, but also the mental health stuff. So, you know, there's a lot of work ahead, and, you know, we still want people to, the mums and dads, especially dads, to continue giving us feedback, because that's important.
Leslie, is that pen pointing?
That is, yeah. I just had a thought. I don't know if this would be possible, but given that the forum, the Facebook forum, has something like 500 members, whether they would agree to do a sort of another short survey of their members using the Facebook, just a few questions to give, you know, a bit more weight, to say, oh, actually, no, here's another 400, because they could possibly get quite a good, they'd have a good audience, and people wouldn't mind doing a short online survey because they're already on Facebook. So whether we could talk to them about that possibly.
I mean, that's something that they are very willing to participate, to be honest, because they did help us with the COVID information,
Right.
you know, to add. So I don't think that's going to be a problem, but they've been amazing, to be honest.
Okay.
Fine, well, thank you very much.
Andrew wants to ask.
Yeah, sorry, I just wanted to say thank you very much to Leslie for the work she'd done, and also to Andrew and the team for getting it on the agenda of the recent Health and Wellbeing Board. Which is great. Sorry, I wasn't meaning to bring it all to a close. So, Andrew, you?
Yeah, a couple of things. So, again, huge thanks to the team for putting this together with such limited resources. And while there was some negative voices in health and wellbeing, the two really key things from it are, A, it was on the agenda. I've sat on health and wellbeing for about 5 years, and I think I've heard maternity mentioned once.
Yeah, quite.
And, you know, I'd like to thank the chair, Howard, for giving us 40 odd minutes, which was absolutely brilliant, because it really did give us a chance to, you know, discuss things in greater detail. But the important thing is not to let maternity just now disappear for another 5 years. This service is not up to standard, and perhaps because it's considered so every day, you know, the whether it's the commissioners, the providers have just thought so every day we don't need to give it our attention. They absolutely do. You'll find it on the front cover of the Independent today. As I said, there's a debate in Westminster Hall. And the other thing I just wanted to make sure is minuted is health visitors again suffered in the same way that both midwives and district nurses did, in losing slots in GP surgeries because of COVID. And what clearly wasn't really happening was any kind of planning outside of the NHS. And this is where I would appeal to the NHS to talk to its partners. You know, we've got all sorts of businesses and theatres and things like this shut. You know, it doesn't always have to be, you know, a clinical setting like a GP surgery just to sit down and talk with someone if you can socially distance safely, or ensure that the place is safe after one meeting or another. So that's been a key problem. You know, I think health visitors have done a sterling job, but clearly massively under-resourced. And I think if we're serious about this 1,001 days, which is one of the two priorities, you know, we've got to make sure that things like health visiting is given the attention it deserves, and the funding. You know, sometimes you cannot get around this. You cannot invent people. and the pressures that new mums are under. If you think of the lockdown and their support network that disappeared overnight, where they couldn't visit parents or grandparents, and if you're, potentially locked in a small flat with a new baby 24 hours a day, I'd imagine that's an enormous strain anyway, regardless of when you then can't access any help. So I think it's key that the board keeps charging us to keep finding this out, and it doesn't just become one report that goes away and isn't talked about. Thanks.
Thank you, Andrew. Right, Alice, you've got a few more items to cover in that item 10, I think. BEMA. You're muted, I think, Alice.
The BEMA conversation is still going on. We are going to be starting a conversation, the diversity forum again. So we are hoping to do something soon. So I will let you know when that happens as well. But we've had some feedback from the community, which Andrew has taken to the CCG, and the CCG's Sam is keen to have a conversation with the community. So hopefully that will take place soon as well. So we've supported that. So yeah. And then
volunteer, how are we doing with volunteers?
Well, at the moment, our volunteers, because of their, apart from the board who are volunteers, the others, I've just kept in touch with them, and they have not been able to support us with the care homes. I was hoping that they would support us with the care home survey, but talking to the residents virtually, but that didn't happen. So at the moment, they are quiet, and we're still recruiting with the hope of looking at what else we can do with the volunteers. So that is going on. But the other thing that we are really, really keen to recruit are young people for our Healthwatch youth program.
Are we having any success with young people? Not sure what the age range of the volunteer group is.
Well, we are hoping from 16 and above. I mean, especially when we are hoping that they will try and engage with us in view. I mean, I've contacted Newbury College to see whether there are anybody there. At the moment, we've not had any conversations that's been successful. But we will keep on going and sharing through social media, through any context that we've got. And we are at the moment very keen to work with Berkshire youth especially.
Right, thank you very much. And that, I think, brings an end to item 10. So we move on to item 11, which Andrew is going to talk a little about, in particular.
Right, so we're right smack bang in the middle of NHS acronym bingo. So apologies for all the members of the public, because this is sort of a super Scrabble score. So we have the Strategic Transformation Partnership has now been renamed the Integrated Care System, having previously at some point been the Accountable Care System. So I think they're running out of 3-letter acronyms, but hopefully ICS will be the last one. This is effectively the Bucks, Oxford and Berkshire West footprint, where there's a belief at NHS England that by doing some things at scale, better care can be achieved, and obviously some economies of scale as well. So how you treat cancer, how you operate your 111 services, and then more broadly speaking, in lines with the long-term plan aspirations, prevention can be looked at, best practice on the sort of more everyday stuff. And they last year had highlighted about 10 or 11 work streams, including maternity, learning disability and autism. They've now all obviously completely blank, digital, which is really, really important. So some of this stuff is really, really important to us in West Berkshire, because of course West Berkshire is right on the edge of the Bob ICS. And as we found with the maternity report, lots of our patients go across the border and use Great Western or use Basingstoke Hospital, which is not in this BOB footprint. One of our concerns that we've raised at numerous meetings, both CCG level and actually at BOB level, is continuity of care and records being easily accessible, without worrying about where you actually went for treatment. This still doesn't seem to be very high on the priority of either the ICS, sorry, or in fact NHS England. And we've also raised this with our local MP. So we are hoping to keep on about this so that we don't become lost and forgotten. You know, if the head of this organisation is resting in Aylesbury or something like that, it's really, really key, especially for the people in the west of West Berkshire who rarely use Royal Berks, that they aren't forgotten. The other sort of two key points about this is they have a new chief executive officer, a chap called Dr. James Kent, who I believe is a former GP that spent a lot of time in politics and policy and was in fact Theresa May's health advisor while she was Prime Minister. So he's operating as the chief exec of the BOB ICS. He's also operating as the chief officer of the Oxford CCG and the Buckingham CCG. So he has quite a few hats, and obviously some very good contacts within government and is influential. And to their credit, they've already met with myself, Mike, and the other health watches. And the really positive news is that they are funding a joint health officer between ourselves and the other 5 health watches involved in the BOB ICS. Catherine Williams, who started in post a couple of weeks ago and had been the joint officer for Berkshire West Healthwatch Group. As yet, though, we have very little detail of what the priorities are going to be. The other important one for us is clearly workforce, because West Berkshire is still suffering with a higher elderly population and incredibly high house prices. So it's really difficult to find places for carers, nurses, and people starting off on their career to live and work in West Berks. And interestingly enough, and we will be responding, the joint housing strategy that's just come out doesn't list carers or care home staff as key workers, which I think is a huge omission. And I know West Berkshire Council Adult Social Care will be commenting on that as well. So that's all I wanted to say about the SDP. Mike, if there's any questions.
Do we have any? I'm slightly confused about the joining up amalgamation of the CCGs. When we spoke with James, he didn't seem particularly suggestive that that was going ahead, but the next day a letter came out from Simon Stevens, I thought, saying everything was going to happen in March next year. Or
well, I think yeah, we have had mixed messages, because originally there was a merger absolutely talked about, the 3 CCGs merging into one. They appointed James Kent to be the joint CCG, the single CCG ICS head. They then said the merger wasn't necessarily happening and there was nothing to report. And as you said, then Simon Stevens effectively has said he wants less CCGs, and in fact called last week or the week before for legislation to actually introduce ICSs into the Health and Social Care Act, because currently they're not actually statutory legal bodies. And it did appear that there was a little bit of reverse engineering to make the existing structure fit the long-term plan rather than actually getting legislation through. But I think they've sort of realised that's harder than possible to actually do. So legislation might be forthcoming next year. But there does seem this huge drive to put any new money into the NHS through the BOB ICS, but action changes at place, or what's called place, which would be Berkshire West. So on one hand, with primary care networks, with the GPs linking up, we should have much more local input, but it does seem to be moving further away at the strategic and commissioning end. So I think we've got to be very, very careful how this develops.
Fine, thank you, Andrew. Adrian?
Yeah, just a comment really. Would it be too cynical to suggest that since there's a clear direction coming from the top, and even though the merge has been delayed by a year, that, I mean, doesn't it mean that any engagement on that is really, rather worthless, isn't it? It sounds as though it's something which, they're going to do anyway, and that seemed to be our experience of the last engagement, when there was very much a feeling against having a shared accountable officer, and they decided anyway to go ahead with it. Or am I being a bit too cynical?
I don't think you're being cynical at all. I think when the train has left the station, it's very difficult to stop it.
Fine, thank you. Right, well, thank you very much for that, Andrew. And we now move on to item 12, the 2020 work plan.
Yeah, so again, hopefully we've got a draft document we can share potentially on the screen, but also we'll share with you, which I think we've done, and we'll put on the website. This changed quite dramatically, obviously, because of COVID. Because COVID didn't exist, it wasn't talked about, so obviously it's had a huge impact on what we're up to. Sadly, our resources haven't increased or changed, so we always have to be mindful of what we can actually achieve, given we have 2.5 full-time members of staff, and all of adult social care and health to deal with across 6 trusts. So we think the work plan reflects this quite well. Michelle, I don't know, are you able to share it, or just so I can quickly talk through what we're up to? Well, this really is magic.
Excellent.
Anyway, so we've sort of loosely defined this into COVID service recovery as an entire area. There is actually, I think there's another version, Michelle, don't worry, because we're going to cover off with that care homes, hospital care and primary care and dentistry as things recover, and sort of keep our eye on how that happens. And then the actual sort of existing work plan as such was going to follow on our mental health work, continue our work on rough sleeping, because remember back in 2017 our aim was to end rough sleeping, or voluntary rough sleeping by 2020, and we did get down to 1.4 people on the street. So with a push from providers, voluntary sector and the council, that is still possible, and with everybody potentially taken in during COVID, there is no reason they should be sent back out onto the streets. And also the other key point with rough sleeping and homelessness is to avoid the causes and people being made homeless in the first place. That was always the aim of the homeless strategy group of the Health and Wellbeing Board, was once we'd actually hopefully dealt with the actual rough sleepers, we moved on to stopping more people being made homeless. Our BAME work, Alice has touched on, this has become again very, very important, because the BAME community already suffered from worse health inequalities than the rest of the community before COVID, and COVID has hit them especially hard, and fatality rates much, much higher, partly caused, we think, by the fact there are more from that community working in frontline jobs, both in health and in key worker roles. So the West Berkshire Diversity Forum has a real job to do, and we're pleased that we are helping out and can be part of that. The long-term plan we've touched on with the ICS work, maternity we've touched on, end of life is going to become more important, so it's down as a high priority, but we're aiming for March, and we're talking to all sorts of people who we were already talking to, so that will go forward. Voice of disability again becomes really, really important. It was scheduled to go back to health and wellbeing earlier in the year, and we've put it back till February. And with Paul joining the board and with his huge level of experience in accessibility issues, we're hoping he can give us some lead on this and make sure this doesn't get forgotten. It's interesting, there's been quite a big furore about pavement parking recently, which is one of the things we highlighted. So watch the space on Voice of Disability, and also our request that it report to the Health and Wellbeing Board. We still think it should. CAM services still seem to be struggling, and again, pre-COVID, and this has probably increased its importance. So we will be doing some more work on that. I don't know if you want to scroll down, Michelle. Carers, again, have had to shoulder so much, and with shielding and the lockdown and potentially more restrictions coming in, the burden on them has increased. So we really do have to make sure they're being looked after, and I would appeal to anyone in the caring who's a carer to feed back to us, feed back to the carer support bodies, and tell us what works and what doesn't work, as we can report back and improve things. And of course, our work on local cancer care, which we had got planned, has probably been delayed a little bit, but has been made even more important by the large increase in cancer waiting lists. Enter and View is mostly on hold, but as I said, we're dealing with the Care Quality Commission on where, when and if we do need to go into places, and I think we will start to reconsider it. Patient transport has dropped off our map a little bit because the changes and or the effect of COVID, but it remains significant. Fibromyalgia work, again, has been delayed by COVID, and outpatients, I think, is something that will develop. So we will continue to keep our eye on that. And again, I think the rest are sort of repeats that we need to just tidy the form up on. So we're hoping to have a work plan document by the end of the month. They can go on our website. Anyone got any questions on that?
Adrian?
Yes, thanks very much, Andrew. There's nothing on the list that I would disagree with in terms of being important. And it's kind of admirably ambitious. But I wonder whether you probably need a long list like that, because things come up and there's the opportunity for maybe taking small actions, a letter here or, feeding something back there. And it's useful to know what you're working, which areas you're concentrating on. But I just wonder whether, and maybe you've got this in mind anyway, of whether it'd be useful to have a Gantt chart of the more significant projects with start and finish times, and something that is really workable, possibly that still has slack beyond that, so that you can meet those targets, but still slot some of these other things in if need be. So just the one or two key projects. I don't know if that would be useful.
Yeah, sorry, Adrian. I think it's something we want to sort of take from a relatively simplistic document that we can put on the front, which sort of, and then we can back that up with some more detail, because there is far more detail on what's actually happening. And what we want to do with the follow-up document is have timelines, elements of delivery and outcome. So you're absolutely right, but there is an aim to try and do that, but we've got to try and almost keep up with the plan on the page idea, and then let people drill down into more detail of what's actually happening. Sorry, Martha?
Yeah, I just wanted to comment on the rough sleeper section, because there are some sort of achievements on there that I think the West Berkshire Healthwatch is sort of championing the cause of homelessness, which Andrew mentioned, has actually raised that up the agenda. And with the additional monies that recently come through from government, I think we are well on the way to actually, doing what the report says, and not having any rough sleeping within West Berkshire, and that those that are on the streets are the really, the people that have really multiple problems. So, we're really moving on to the prevention. So the work there and the housing strategy group is really working so well. So that, although it's there as high, it actually has moved on quite a bit. So there isn't the amount of work to be done there maybe that there used to be, and that we're moving on to the prevention side. So it's a sort of highlighting that although it's still high, it actually is almost, achieving its goals. I don't know whether Andrew agrees.
I think, as I said, I think so. I think, we took an awful lot of flack for saying it should be involuntary rough sleeping should be ended by 2020. The official Whitehall government target was 2027. West Berkshire target is 2025, which is just not ambitious enough, and especially when you're talking about numbers of 4 people. But, you know, to the credit of certainly West Berkshire Council's housing team, the Holt outreach team, and the voluntary sector who've been involved in that, they have done such an amazing job in getting together and actually for the first time I've really seen applying the sort of Marmot principles of making whoever was the person with the best contact the lead, rather than saying it's on my job description that I have to lead. You know, it really has been brilliant, and I think it does show that West Berkshire is a real Goldilocks zone. You know, it's not too big, not too small, it's just right, and you don't need too many people to make significant differences. So while I'm absolutely delighted with the role we've played in it, a lot of that has been about facilitating, opening conversations up, changing people's perspective of what one organization or another does. And what I'd like to see, and it's, you know, real firm belief, is that the same style of committee and action is applied to everything, because it works. It absolutely works. And, you know, for anyone who wants to know how do you solve something, well, you kind of do it like this. You know, you try and leave the blame at the door, but you equally rely on accurate figures. You know, it's a big story this morning, accuracy of figures. You not only need to know what they are, but you need to monitor them, and you need to know what your successes are. So it's not how many have I got today, but it's what's happened. Have they come back? Have we really got them off the street long term? And then you actually start to let the system heal itself and use peer support, people who've got off the street to actually help the next group of people get off the street. And there's an awful lot of people on this call who've had so much to do with this, you know, and they should take great credit for the amazing results that West Berkshire can quite proudly point to. So, yeah, so the work plan is just an ongoing document, and hopefully will continue to change, but we want as much public input on what goes on it. And, you know, Alice just pointed out in the chat box that we've also got some more Great Western work going on with a virtual enter and view style visit planned for next year. So we can potentially do what we're meant to do, but potentially in a different way. But yeah, busy, and we could do with some more resource, but then who couldn't?
Thank you, Andrew. Right, we'll now move on to item 12. Last Friday, Andrew and I were due to have a meeting with PwC and the Chief Executive of West Berkshire Council and the Chair of the Health and Wellbeing Board to talk about an update, and it was cancelled at the last minute. And while driving around on Friday, I think I learned the reason why. So Andrew, over to you.
We've got both these hospitals potentially being rebuilt and at various different stages. So it's kind of difficult to know because it's moving at a pace, and they're coming up with the options for both the rebuilding of potentially Royal Berks and or Basingstoke and Winchester, both of which will have a dramatic effect on the residents of West Berks. But as was highlighted in the press, ambition and funding don't necessarily seem to match, because it seems to be a sort of view that if you genuinely want a state-of-the-art 21st century hospital, you're looking at a bill somewhere between 600 and 700 million per hospital. So we know that Royal Berks has secured 200 million, but I don't know what that necessarily gets you. That isn't saying that's the end figure, but you know, when you start off with absolute blue sky ambition of what you can do, what you think you need, and although it's an enormous sum of money, you know, in the great scheme of things, that doesn't necessarily get you what you think you need. So we really do need to keep him involved in this whole process. As I said, I've been really pleased with, you know, Hampshire's engagement has just been superb. Royal Berks not so hot, but hopefully it will improve, and some of the lessons learned will help with that. And again, I think it's really, really important that the public really keep their eye on this and let us know what they think and what they think they really need for the next 30, 40 years, because, you know, it's very easy to make statements on the steps of a ministry, but at some point you've got to deliver something that's actually going to change people's lives, and in conjunction with the long-term plan. And also the item Sarah Rayfield talked about at the start of this, these are all linked. So the joint health and wellbeing strategy, the new hospital, they're all linked. You know, we need to have better outcomes. You know, we need to catch up on our continental partners in terms of outcomes for cancer and various things like this, because we're just not getting it right. And it's not through want of trying, it's not through care and attention. We can just get better at it. And also we need the public to play its role. You know, prevention is really, really key. And, you know, the comorbidities that have impacted so heavily on COVID impact on everybody's lives. So it's not about the public just saying, you know, cure me. You know, people have to really, really start doing some stuff for themselves. And it's not because the NHS is failing or anything like this. It's just that the sheer change in lifestyle and the sheer difference from when the NHS started, and most people working in pretty physically intensive roles, to now there's lots of us sat in desks looking at screens for 8 hours a day, and not walking enough and not doing enough physical exercise, you know, and it's impinging on all of us to actively help, because if you help yourself, you're helping everybody else. And you know, so really, really important. So I think this is a watch this space. I'm pleased that we have been invited in this. I'm pleased we've been able to help facilitate contacts. And I think that's all we've got to say, Mike. I don't know if you want to add anything to this, because you've equally been involved quite heavily.
I just say, which is not directly related to that, well, it is, I suppose, is that prevention is far better than cure in most things. And that obviously is what we should all be aiming for. I know we can't prevent everything, but we can a lot. My impression was that, I can't remember the figures, but I assume Hampshire must have been awarded a much larger sum, because they seem to be talking definitely about having a new hospital.
Mm.
Yes. There seems to be quite a lot of hearsay about, because at the same time we were told all the options from the table. You know, I was also hearing rebuilding Royal Berkshire somewhere else is not on the table. Mm. So, you know, again, promises and statements are one thing, but actions are the things that really, really count. And I think, you know, the folks in West Berks really need to keep the pressure up to get the actual facility they really need for the next 30, 40 years, because it will affect everybody's lives.
Indeed. Thank you, Andrew. Martha, you've got a comment?
Yeah, I just wanted to, there's a consultation on both hospitals. Is that ongoing? What's the status of it, and how long is it going on for? Because you don't hear much about it in the community or on the council even, and it's such an important issue for our local area. So how can people get involved in the discussion?
I think there's two major websites. One's called Hampshire Together. Adrian, you might know the Berkshire one. Is it Building a Better Berkshire or something?
Not offhand, but there is. I mean, there is a link. I'm sure we could send that round.
There is a link on the RBHFT website, isn't there?
There is, and the consultation is going on at the moment. But I think what they're getting to at the moment is both hospitals have gone from every option to now narrowing down the options. So I know I saw a Hampshire chart that sort of narrowed it down to 2, and I think they have to present it to the Treasury and the NHS to start with, and then it will come back next year for a proper consultation with the public on this is what we think we want to do. So we will obviously publicize this, Martha, but equally you know, we need other organizations as well to make sure they let people know that when and if things that come out that need people's attention, but I think people should be taking attention of it now and potentially writing in with their thoughts to ourselves, to local politicians, to the Royal Berks, to NHS England, if they have strong feelings on either side. And I think especially the people who are affected by, if the talk of Basingstoke and Winchester either merging services or moving hospitals, because I said this to their chief executive, if you move a new hospital 10 miles further south of Basingstoke, let's say, that has a dramatic effect on the people from West Berks and Newbury who currently use Basingstoke, because that would make a huge difference. So I'm pleased that we're involved in the conversation. I'm pleased West Berkshire are involved in the conversation, but we are very much a minor partner, because they're looking at the whole of Hampshire and the Isle of Wight, and something like 5 CCGs impacting. So we do need our local stakeholders to keep on this if they can. But we'll get those links sent round and put in the minutes and on our website if they're not already.
Okay, thank you, Andrew. That brings to a conclusion item 13. We now move on to questions from the public and those registered to be part of this meeting. We have had one question in advance, which I think from a lady either was or currently in the United States. So I don't think sorry, Andrew,
if you open the chat bar, Mike, I think the ladies also popped it in the chat. And
yeah, and I'm not going to, I don't propose to read out the particular question, but just to say that we will discuss this question, and a written answer will be provided, but we won't discuss it online now. So has anyone got a question from those? Yes, could you just please identify yourself and ask your question?
Hello, hi everyone. My name is Angie Nagmeddine. I'm here wearing two hats, one a West Berkshirian or living in Newbury as a citizen, but a mostly Community United comms lead. So I have actually 3 questions. I would start with the maternity one for the BEMA, and it is basically directed at the Health and Wellbeing Board if there are specific steps that have been taken towards ensuring that women coming from ethnic diversities have all the due care that they deserve, bearing in mind that it has become exceptionally, as in your report have said, extremely kind of challenging during COVID times. So during the pregnancy, after the pregnancy, and definitely after, with health visiting and midwifery as well duties. The second would be is mental health for youth, specifically secondary schools, as part of me being a mother of a secondary school teacher. I have realized that there have been a lot of unanswered challenges from the staff within specific schools, and I can email the board that later, but basically kids are struggling, whether that is because of what Martha has thankfully kind of raised about domestic abuse not being addressed, whether they have been stuck and when returned to school, things have escalated. So how is this, or is there any way to address mental health issues for young children within school by Healthwatch? It's just a generic question. And last but not least is how can Community United in the future collaborate with Healthwatch into making all your comms or surveys, as we already do, kind of given to people in hard to reach areas? And if so, within all your projects, if we can be included as a collaborative partner. Thank you very much for being here, all of you, making health a a priority for all residents. And I thank you as a citizen myself. Thank you all.
Thank you, Angie. Andrew?
Right, I'm not on mute, am I? No. The maternity question, I think, is really, really key, and I think formed part of our follow-up to our report. And I think our broader conversation with Sam Burrows is going to have some direct impacts on this, and also Healthwatch England and NHS England, because whatever issues we've highlighted for the general population always seem to be amplified 5 or 10 times worse. And I think there was a report, the maternity outcomes are 5 times worse from the ethnically diverse communities. So we've clearly got to do some work on that. But I think the one thing that I think is a real challenge for us as an organisation and also for the actual community is there's clearly some trust issues that have broken down in terms of feeding back, and also both cultural issues and also issues of it often reminds me a lot of our sort of much older generation who refused to complain about anything, and stoicism to the extent that they were probably damaging themselves. The one thing with complaints or the niggles we deal with is people think, oh, that's really serious. Well, it is. But the way that the aircraft industry has stopped airlines falling out of the air is that they look at things that go wrong and try and put them right. And, I would constantly say to people, please complain. It's not because I want you moaning. It's because what happened to you, and if it isn't necessarily at a formal complaint level, but it was something you weren't happy with, you can absolutely bet your bottom dollar it probably happened to 5 other people, and it's at its most serious extent, it can end up with things going horribly wrong. So complaining should be turned around from being a very negative thing to being actually quite a positive thing, where actually your experiences are there to actually help. And also, it's not just, don't just complain. Tell people when things go really well, because the providers need both ends of this. Where we're getting it wrong, but equally, there's a brilliant doctor, a brilliant nurse, a brilliant ambulanceman who did this and did this and did this, and it made such a difference. Because if you look at sort of Victorian doctoring, where they virtually had no medicine, the occasional leech and things like this, it was all about the whole experience, and it was that whole emotional human thing, and where you stop relying on drugs and surgery and things like this, and actually start relying on looking at the person holistically. We have to do this, and this applies to everything. But so the community, we absolutely need the community. We've got to work really hard on this, on getting them to feed back and be happy to feed back and see it actually as a positive thing to do, rather than a negative thing where they may feel they may get picked on or something like this, because it's the only way of us improving things. So we have to do that. Secondary school mental health, I think we've highlighted in our work plan, is a concern. It remains a concern. And when you bear in mind what's happened with exams, with universities, even to some extent with young people being blamed for, COVID being spread, their lives have been tipped upside down from just 9 months ago, and they were already under amazing pressures. So I think it would be lovely if we can come up with a workable version of thinking together that would really start to deal with adolescent and young people's mental health, and maybe we need to do just a thinking together for young people. I don't know. I mean, that's just something that comes to my mind, and maybe we need to work with the schools, the young carers, Berkshire Youth, and the various youth councils, and sort of say, well, look, this is specifically for you. We'll make sure old folk like me don't run it or take too much of a part, because that puts people off as well. So we definitely do that, and I think working with Community United becomes super important, because you guys have got all the contacts with the communities who are suffering, and we've had criticism of our maternity report because of the low number. Low numbers do not detract from it still affects people, and if it happens to one person, it shouldn't be. And it shouldn't be working on the basis it has to happen to 1,000 for us to take any notice. So, and I really love the idea of the comms and making sure our comms are a bit more accessible to all. And we haven't solved that, by any means. So, let's keep talking about that and ensure that even if it's meetings like this, that we've got accessible agendas for all. And, you know, we aren't there yet. And I'd love to be able to say we are, but let's work towards it.
Kevin, sorry.
Yeah, sorry, Kevin.
Hello.
Hi.
Yeah, I'm Kevin Hood. I'm chairman of Depression Expression. Angie, I don't know if you know about Couth.
No.
Heard about Couth?
No. No.
There are a number of organisations that directly will help young people. So if you stick on www.couth.com, it's an online service for mental health in young people. They can have access to psychiatrists, psychologists immediately. So do please check them out. On top of that, there's a children's support line called Shout, which is a text service, so that can be very discreet. They've got the number of 85258, and children can just text and they'll get replies for that for any of their problems. So they can do that discreetly without anybody looking over their shoulder or hearing. The last one I've got is the helphub.co.uk. That's another one that will help more children's support.
Thank you very much for that. Yeah, I only knew about Shout. So yeah, so absolutely, I will bring that forward. And to answer your question, Andrew, one suggestion about how to reach could be, you know, how people go almost like door to door with an ID, kind of from Healthwatch or from West Berkshire Council or from, and it can be like that kind of, because word of mouth do travel within communities of diverse ethnicities. So but of course, due to COVID-19, lack of resourcing, people not going to work, this will prove to be very challenging. But I think face-to-face contact with older generations or people coming from diversities might be a thing to consider if we are bound to be with COVID circumstances for the best part of September next year. So.
Thanks. I think the other thing, I've talked to Alice briefly about this, and we probably forgot to mention, is one of the key things we can do is get some more volunteers from the smaller communities, because then, you know, the best way of people feeling a part of something is to see people they recognise and can associate with being part of an organisation. So when we're talking to volunteers, we as an organisation have to work a bit harder in making sure we go find some volunteers, because, you know, we've had some brilliant volunteers from time to time. We've ended up with people like Nathan working for us. We've ended up with other people ending up working for Public Health England, Healthwatch England have pinched some staff. You know, it's a really good way into all sorts of different things and careers. So, you know, I'm really proud that we've worked with all sorts of different folk from all sorts of different places. And, you know, we will do our very best to continue to do so. And, you know, I'd hope the board equally are as committed, making sure we try and reflect everybody living in our community and get the expertise in where we need it.
Thank you for that.
Thank you, Angie. Thank you, Kevin. Are there any more questions? No. Are there any other matters of other business from the board? No. Well, thank you very much. I declare the meeting closed, and I think we have got a date for a meeting in December, have we not?
Yes, 7th of December is our next meeting, and it looks like it's going to be 1 p.m. to 2:30 p.m.
Yes, without the mince pies and...
Maybe bring your own.
So it's a bring your own mince pie party.
Very good. Right, well, thank you, everybody. Thank you especially to members of the public and the professions who joined us today. We really want more and more people to do it. Although I don't know what happens to the screen, it becomes smaller and smaller. Andrew.
Could I just ask the members of the board just to hang on for a second at the end of the meeting?
Certainly, yes, we'll do that. Right, thank you very much then. And I declare the meeting closed.
Thank you.
Thank you.